I didn't know she wanted to be a donor, and I'm so glad. I'm so proud of her. You know, people said years ago that you don't want to sign up to be a donor because they won't save your life. But the hospital fought so hard to save her life. It just wasn't meant to be. Kristen loved making people happy. She loved making people laugh. She loved to party. She had rowdy friends. And she was a rowdy girl. But I loved her so much. I could put up with the rowdiness right now. This is her daddy and Kristen, and we were at a wedding. They danced and partied, and her boyfriend was there. And oh my, when I get her ashes, I'm going to have her buried with her daddy. And I'm proud that she can be the donor, but I'd rather have my daughter.
The opioid epidemic in Kentucky and in our region, I think, really started to affect us about 3 to 4 years ago. We saw some ERs 500-600% increase in overdoses within a matter of a year. The silver lining to this devastating situation is this surge in overdoses has provided a surge in organ donors. You have to determine, while they were down, what was the level of brain damage. If there's no blood flow to the brain is dead by definition. I tell families the person that you knew and loved is gone. And now what we have is the shell of their body that's still here. I know the heart's still beating, but the brain is not working and won't work again.
Her finger was going like that a while ago. It was shoulder shaking just like mine. And they said it was a confined nerve in her spine or something like that. I don't know. But before they did the test on her brain, and she wasn't moving at all. Nothing was moving.
This is Ashley. All right, this is a 38-year-old woman. She overdosed on meth and heroin. This patient came in a little over a day ago. She was with her significant other. He found her actually in the bed, and she wasn't breathing, so he called 911. The patient is a labeled high-risk organ donor. She is Hep C positive, which we see a lot now due to the drug epidemic. Most of our patients are Hep C positives, and they make those recipients aware because at that point it's the recipient's choice if they're willing to take that risk. Her liver numbers did triple, they elevated, but they're trending back down now. Are you interested, or? And we did go into it saying this is gonna be difficult to find a recipient because they're kind of in, what we call marginal shape. They're not great, but they're not bad enough to not offer them. A lot of the organs take a really big hit when you overdose and you're down and nobody finds you for 4 hours. That takes a hit on your body, and they don't want to put the recipient at risk for not having it take. We've like doubled the bicarb drip, haven't we? Yeah. Let's just push an amp then. We'll just give her a little burst. Yeah, we'll just push in. So far, I have allocated the liver and the heart I'm still working on, and the kidneys I'm also still working on. I have interest in them. I think hopefully we can find a recipient, but right now I don't have one.
You did such a good job, Chris. Goodness.
You get in situations where nobody will take the organ, and it's heartbreaking. Sometimes I go through and I can't find a recipient, and it's awful to have to know for that family they're not going to get that silver lining, if you will, or the kind of only happy thing that can come out of a loved one overdosing. You just bring that down. Okay.
They're going to take her down the hall and they'll do a tribute to her. I said if she could, she'd sit up and wave. I know she would.
Thank you for being here. We appreciate it. Does everybody have 5 minutes? Yeah. Good. Okay.
lot of what I do is talking with people on waiting lists in a room just like the one we're sitting in here. The conversation goes a lot like, Doc, am I going to be a drug addict if I accept this organ? And we tell them 100% no. When we get the organs, we flush the donor's blood completely out. For the most part, you can use basically everything in the abdomen, such as your liver and kidneys, because those are more filtering organs. They typically try to get rid of stuff that's in our bloodstream. It's ultimately the patient's decision, right? We don't coerce anyone to take the organs. We don't change their place on the list or what have you, but we just like for them to have all of the elements that they need to make an informed decision. And what I tell them is that, there's a very small chance that they will contract something, but then we talk about as well their risk of dying on the wait list if they don't accept the organs. We know that their chances of dying on the wait list increase threefold. So if I'm putting myself in the position of my patient and a high-risk organ becomes available for me, say a kidney, and I've been going to dialysis for however many years, 3 times a week for 4 hours a day, you better believe I'm taking that organ. Now we have medications that can, cure the biggest thing that most people can get, which is hepatitis C. Most programs across the country are using these organs now without hesitancy. 5 years ago, I wouldn't have been able to say this to patients, but because there is a cure, more people are willing to take the chance of taking these types of organs.
You don't believe in luck? Say it ain't on Fox Richmond.
November the 9th. They told me this kidney was on its way, but it was coming from out of state. It was in the middle of Social Security Bureau. And you're really not supposed to have your telephone on or anything. But I told the people, I said, I'm waiting on the kidney just like that. So I'm not cutting my phone off, being honest with you. When I answered the phone and they told me that this was the transplant candidate, I just started crying. I was discombobulated all the way. I just started hollering, jumping, and praising God so much until they didn't even come near me, because I told them, don't come near me right now. Don't come near me. I said, this is about my kidney. All I know is that she was found in her 30s. They said that she was an IV user and she had died in a drug overdose. Oh, Lord, my knees, girl. When you think about, not taking it, you think about, going back to dialysis, being sick all the time. You should be grateful to receive that organ because, your risks are so low. So I told them, I said, as far as I'm concerned, it can have Hep G, L, F, or whatever it wants. I said, well, get me one off just like that. And they just laughed. I said, I don't care what it got, just get me one. And that's what they did. Yes. Since then, everything has been going pretty smooth and calm. I'm not having any issues with my new kidney. Hey, Doc, how you doing? Good.
What we do to prevent transmission of hepatitis C from the donor to the recipient is use the same drugs which are used to treat hepatitis C. We will give 1 dose of a medication right before transplant and then give 3 doses after transplants. The alternative would be to give the full 12 weeks of treatments. So with our strategy, we were able to reduce the transmission from 100% to 13%. So the kidney function is stable. The hepatitis C virus, which we've been checking for you, has stayed negative. It's been negative since the day of your transplant.
This time you got to come to me. I told him I love y'all. If I could speak to the family that was the donor of my kidney, I just first will give them a big hug. There are no words to express how I feel, but in an attempt to try, I want you to know that I thank you so very much, and I'm grateful to be alive.